The patient is being treated for a right mid-substance patellar tendinopathy that has been affecting the patient's physical activity for the past 6 weeks. Please demonstrate your ability to apply thermal ultrasound. Begin by gaining informed consent and explain your steps as you perform the skill. Follow-up questions will be asked if needed.
Okay. Good to go?
Yep.
Awesome. All right, so hi. So it looks like you have tendinopathy, mid-substance. It looks like in your quadricep tendon, or leading into your patellar tendon. My recommended treatment for this would be thermal ultrasound, due to it being able to kind of help up with the breakdown of that tendon. It seems to be a chronic issue, so that's why we're going to be using a little heat for it. If we do this, it'll definitely help the pain in that area, as well as increase the nutrients to get to that area. And if you don't want to do that, we can also use a heat pack, but I really don't think that would really help as well as the ultrasound will. And if we do nothing, I mean, you're just going to be in pain and have that uncomfortable feeling in that area. So, I mean, whatever you want to do is fine, but I'd recommend the ultrasound.
You can do it.
Okay, cool. So, before I do this, so I've gained informed consent, and then I'm going to look at the area. You said right, correct? The right? Or?
Yeah.
Okay. So I'm going to look, make sure there's no like metal implants or any like tumors, open lesions, anything like that. There's nothing. So what I'm going to do is grab the 5-centimeter sound head, and I'm going to plug it into the machine. Alright. And then I'm going to take these are the markers. Good. All right. And I'm going to put it at about 3 times the size of the head.
You're doing a patellar tendinopathy.
Yeah, so it's right.
Okay.
Right? Because it's like the quadricep tendon equals connects to the patellar tendon, right? No? All right, we're going to go lower than that. So we're just going to. All right. Yeah, so it's going to be here. Yeah. Because I was looking at this like quadricep tendon, so I was like,
No
could it
worries.
equal that? But all right, cool. All right. So I got 3 times. We'll get to the point there. All right, so you make an area 3 times the size of the ultrasound head, and then. You're going to take the gel, you're going to just kind of put it all on the area that's needed. Make sure you have enough coating to allow the electricity to conduct in that area, or not the electricity, the heat. That makes sense. So I'm going to do ultrasound, edit, frequency is going to be 3.3, and then the treatment time is going to be, I'm going to put it at 4 minutes because I'm going to be using 1.5 for my intensity. And then I'm going to turn the wattage up to 1.5. And then I'm not going to start it until I place it on her.
What's your duty cycle?
Duty cycle is 100% continuous, and it's going to be about 4 minutes. So.
Are you going to do anything else with the ultrasound head before you put it on?
Take off the cover. Yeah.
Okay.
And then I'm not going to start until I put it on, and then I'm just going to make a continuous motion, making sure that the head stays directly perpendicular with the area, and just making small circles, making sure the gel kind of stays in that area, and just making small circles in continuous motion for that duration of 4 minutes.
Say the 5 minutes elapsed. What are you doing now?
So then you're going to stop treatment. So you're going to remove the head, and then you're going to hit stop, and then that's end of treatment. You're going to sanitize this with this, and then you just you basically desanitize this, considering it was touching skin. Then you're going to shut this off. Then you can unplug it if you need to. And then you're going to wipe off her leg, and then you're going to be looking for if there's like blistering or like really tender skin, which would indicate that the treatment was too effective, as it just basically damaged tissue.
And then, did you give her the risks and benefits of your treatment plan today?
I did not.
You want to go through that?
Yeah, sure. So basically, do you want to like tell you or okay?
I can talk to you.
Yeah. So the risks of ultrasound are if I kind of stay in the same area or put the intensity at too high or keep it on for too long, there's a cause of thermal burns on the skin, and then it could damage the internal tissues as well. And then for a heat pack, I mean, it's the same thing. As long as it's on too long or it's too uncomfortable for you, then that'll cause tissue damage, which is not what we're trying to do.
And then prognosis, if this treatment plan is administered?
I had said that, but if it is administered, it'll help reduce the damage that's being done, since it's a chronic issue, and we need to use heat in order to bring in the nutrients into the healing nutrients into the area to help, because the tendons aren't very vascular. So.
Okay.